Greetings. I am Rosalind Parks, and thank you for tuning in to this edition of National Network View. With vaccine mandates in the headlines these days, many may have questions about what the year 2022 holds for the workforce in the United States. Joining us is NNV medical contributor, Dr. Akili Muhammad. Greetings, sir.
Greetings, ma'am. How are you?
I'm fine, sir. Thank you. Dr. Akili, many businesses are preparing to comply with the mandate that states if you have over 100 employees, they need to show proof of vaccination or negative tests weekly. A judge just paused that mandate recently. Do you think that these types of vaccine mandates are working on the public?
I have been paying attention to a lot of what's going on around the country, and I think there's like a serious line drawn in the sand these days. I don't think there are many people that are like straddling the fence anymore. There may have been, as we've talked about previously, there may have been some people that were talked into taking a shot or bullied into taking a shot.
Right.
But I think we've been going through this vaccine reality long enough where people are really split on where they stand. So it's kind of surprising to actually witness. This is like, as the minister has taught us, this is a fight between the white community, because they really don't take much of us into consideration, but they are literally having a serious civil war in this country on a lot of different fronts. And the one that's taking center stage most is, of course, the vaccine. So, judges like these, and I think this has happened in multiple states where they are siding with the people versus some other states that are definitely siding with the vaccine mandates and seemingly siding with the companies. So it's, I think, one of those situations where it's going to be serious odds and potentially, as we have spoken before again, a potential spark of anarchy in this country.
Yes, sir. And now that approval has been awarded for 5 to 11-year-olds to get the vaccine, it's being said that approval for children as young as 6 months is in the works. Do you have any information about this, or would you be willing to share your thoughts on that?
Well, the only information, of course, that we have is what they're releasing. But people that are asking to specifically see these studies, they're saying that they don't have the information tallied so that we can look at it. So I don't really have any specific information. What I am doing is looking into a lot of the studies that are coming from other parts of the world. As we've seen, there are a few countries in Europe that have totally stopped some vaccines because of the potential of myocarditis in young people. Mm-hmm. And if I remember correctly, I think it was Sweden that stopped it from, I don't remember the age, but I know it went all the way down into teenagers. There are many pediatric doctors and pediatric healthcare workers in this country that have seen multiple children have serious problems. And then, of course, we've seen some reports where there are young people who are taking the vaccine and are athletes, and they're seeing a lot of problems. Some just having cardiac arrest and dying. Some of them having serious problems, can't continue in physical activity that they were doing prior to having the vaccine. So it definitely is something that I think is stirring up a serious response. And, for the push to continue to suggest that, in addition to suggesting that pregnant women get it, I think is going to cause a lot of, again, it's going to be a part of sparking an anarchy, because a lot of people, especially healthcare workers, are seeing that this shot is definitely having some serious side effects in children.
Yes, sir. And what is your assessment of the push for the holiday vaccination?
Well, I think that, in any situation where there's a need for information, right? Because I have said on many of occasions, as well as we've heard other people state in public, that the type of information that is being spoken of in public, on the news, in social media sites, definitely is not the body of knowledge that an average person can understand. It takes years to understand these things that are being spoken of in news. And so when we're literally talking about coming up on a year of the vaccine actually being available to people, some people have really taken a side, as I said earlier, and some people have already seen the reality of negative effects. And then you have some people that 100% believe that it is the reason that there is a downturn in cases. So I don't think there's any middle ground. But to say that they want people to get vaccinated prior to the holidays, those who have experienced this and really thinking their way through things can say to themselves, the majority of America, because it was not open to the public yet last year during the holidays, the majority of the people that got COVID during that time made it through it pretty well. There was not a large number of cases during this time of the year last year and then coming into early this year. So, some people are looking at it from a common sense perspective, looking at what happened last year, even though they keep getting this information that these new strains are more deadly, potentially more infectious, potentially cause more problems. I think people in general now are starting to use a little more common sense after being in a pandemic for a year. So I don't think many people are going to go for it.
You're right. I agree. I don't think many people will go for that either. Now, one of the questions that I wanted to make sure that I asked was, what are you doing and what do you suggest as activities people can do going into the cold months and into the upcoming year to protect themselves?
Yeah, I think the first thing is to try to maintain some type of physical activity as the months get colder, because typically when it gets cold, people decrease their physical activity. So try to do something, even if it's in your house. If you have stairs, you can walk up and down the stairs, do some chair lifts, push-ups, things that don't necessarily you don't need to have to go outside. The other thing is that during a time, a period where you're not spending enough time outside, or maybe not as physically active, then you have to step up your dietary needs to make sure your immune system is functioning well. So we're talking about vitamin D, vitamin C, the type of foods that give you a lot of good phytonutrients, which are all those beautiful substances that we get from fruits and the different colors of fruits. And so I think it's important for people to do those things. And then, of course, to try to maintain thinking positively through these cold months, because as we see, the propaganda in the media is starting to pick up on what's going to happen during these cold months, what's going to happen during the flu season. And so they're trying to spark back up this fear campaign. And if people are doing something every day to work on your health, to improve your physical ability to combat these things, then you don't have to give into these fear campaigns.
Right. That's some good advice. What is new with the Ultimate Wellness Group?
Well, what's new in the Ultimate Wellness Group is that we have now had some subscriptions. So people that have been following the Ultimate Wellness Group Transformation Tuesday, they've been supporting it for years. There's ways now that you can definitely support the Ultimate Wellness Group in another way, which is financially. So those have been put together. We're going to go into a little more depth so people know exactly what they're getting. But if you all are interested, go to blackstream.live/TUWG/Tuesday, and you'll see the different subscriptions there. You'll see the different live programs that we've done that are there in the archives. So, take a listen and let us know what you think. And when you get a chance, join us. Today, there will not be a show. Taking a little break today, but we'll be back Tuesday with another powerful show. God say the same. Thank you for asking.
Yes, sir. Yes, sir. Thank you, Dr. Akili, for joining us this week and every week. And of course, we look forward to hearing more from you and the Ultimate Wellness Group next week.
Thank you. Appreciate it.
Yes, sir. Thank you for joining us today and tuning into National Network View News. Please share your thoughts with us in the comment section below. Follow us on social media at NNVnews, and please subscribe to our YouTube channel, NNV News. This is Rosalind Parks with National Network View News. Good night.
Be a part of the force that powers truth in journalism. Your support helps to combat false media. Cash App NNVnews.
AsiaticMinds.com. Online education, helping our children to discover their God-given skills, gifts, talents, and passion that will allow them to see their greatness, as well as the greatness of our people. And upon discovering that greatness, infusing them with the desire to use it for the betterment of themselves, their families, our people, and the world. 2022 through 23 enrollment waiting list open now. Visit AsiaticMinds.com.
Worldwide, 24 hours a day, 7 days a week. Download the Final Call Radio app and take us everywhere. On your phone, on your computer, on your tablet, on Instagram, Facebook, and Twitter. You can also log on to finalcall.com and click the Listen Live button, or finalcallradio.com. Final Call Radio, the official voice of the Honorable Minister Louis Farrakhan and the Nation of Islam.
Thank you for tuning in to NNV News. Please share your thoughts with us in the comments section below. Follow us on social media at NNV News, and please subscribe to our YouTube channel, National Network View. This is Clifton Muhammad with NNVnews.com.